Hello again, chapter 52 in our MedSearch book, Caring for Patients with Personality Disorders. We are just rocking and rolling here with this, and we're almost through with what we need to go over. So, I'm going to go over a few things with y'all. Be sure that you follow along in your book, do your PowerPoints, take notes, because it will help you. Um, Chapter 52, Caring for Patients with Personality Disorders. We need to talk about identify the major features of a personality disorder. We're going to talk about that. We're also going to adapt the nurse patient relationship to specific concerns of the patient who has a personality disorder. So we need to pay attention to that. Um, Collect and document information about patients' behaviors related to personality disorders. Prioritize the importance of patients' behaviors related to our nursing actions and apply the nursing process to the patient with the personality disorder. So it's a lot of the same stuff, y'all, but we just have to go back over it and over it. So I hope it helps y'all as y'all proceed on with your nursing, that you will remember some of this to kind of help you get through. Be sure that you're reading your chapters in your book, looking at your PowerPoint, listening to what I say. Also, your NCLEX is a great reference. Okay. You also be looking at your ATI as we go through this too. Mental health ATI will help you. Okay. Identify the major features of personality disorders. There are five basic personality traits in every person. You probably can name them for yourself. An individual personality expresses each trait somewhere along the continuum between two extremes of the trait. The five basic personality traits are extroversion. We all know what they are: agreeableness, conscientiousness, emotional stability, and openness. So those are extroversion, um, agreeableness, conscientiousness, emotional stability, and openness. While the normal range of human behavior, feelings, and thought is broad, it is possible for the personality to be outside the normal range. A personality disorder is an enduring pattern of inner experience and behavior that has following characteristic. It deviates markedly from the expectation of the individual's culture. It's a persuasive and inflexible. It's persuasive and inflexible. They deviate and they're persuasive and they're very inflexible. They're not going to deviate back to the norm. It begins with adolescence or young adulthood. It is stable over time, and it leads to distress for individuals or impairment of functioning. A person's personality significantly affects how a person responds to life events, including illness. Thank you. A patient's culture also affects the patient's behavior and personality. It is important to consider a patient's cultural background when interpreting behavior. How many times have we said this? Through every bit that I have taught you this semester, we talked about culture. Culture is very important in every aspect of nursing. So we've got to always remember that. The American Psychiatric Association describes 10 specific types of personality disorders. Did you ever know there was that many? They are grouped into three clusters by their similarities. These clusters are cluster A. Cluster A includes odd and eccentric. Cluster B, dramatic, emotional, and cluster C is the anxious and fearful. There are four main categories of these features common to all personality disorders: impaired self identity, distorted thinking patterns, blunted and distorted emotions, and impulsive and inflexible behavior. So, adapt the nurse patient relationship to all these, the special concerns of the patient who has a personality disorder. It can be challenging to care for these people. I think some of y'all have seen that. Personality disorders are difficult to treat because a personality is resistant to change, and there is no medications that affect personality disorders. Um, Nurses often find it frustrating to work with patients who have disorders of the personality. Um, Over the time, these patients have developed maladaptive. Remember, we talked about maladaptive, not good coping mechanisms. So, maladaptive would mean bad coping way they cope with life. Patients with personality disorders, they're socially inappropriate and sometimes very difficult. Direct communication with clear expectation for patient's behavior and clear, consistent limits is important for the patient who have personality disorders. Nurses who work with patients who have personality disorder must understand themselves first and understand their professional responsibility to be most effective. Nurses must have the insight to know what type of behavior causes them stress so they can act rather than they can react to the patient's behavior. So we always have to be like one step ahead of our patients to really understand them. But the only way we understand them is to talk to them and try to talk therapeutically and try to figure out what is going on. The nurse remember that the goal of the nurse is to provide professional care, not to be the friend of the patient. Okay, you have to distance yourself socially in so many aspects of nursing. It's hard sometimes, but you have to distance yourself. Objective understanding of personality disorder will help nurses teach an objective approach to patient care. When working with patient with paranoid personality disorder, the nurse must keep in mind that despite the patient's aggressive appearance, the inner feelings are often fear and insecurity. They may be super aggressive on the outside, but they have this uncanny fear and anxiety inside of them. The patient with feelings of fear and insecurity often respond to reassurances about their safety. So if you can ever get that out of them, then reassure them they are safe in whatever environment they're in. The patient with paranoid personality disorder is often very aware of the power aware of power relationships. This so the patient may respond better to information directly from the physician or the charge nurse rather than from the staff nurse. So you have to figure that out. Don't take it personally if they don't want to talk to you in your role. If they want to ask to talk to the charge nurse or the doctor, then get them in there. But don't act like you're mad about it. Just say, "Oh, I'll be glad to do that." Don't kind of come across like you're hurt or you're, well, I'm not good enough. And treat them, let them, kind of get their information. If they feel like they need that from a higher source, then go get it. Okay. Patients with paranoid personality disorder, schizoid personality disorder, and typal personality disorder do not enjoy being around people. However, they require enough interpersonal contact to keep them oriented to reality, but not so much that they cannot cope. So you need to give them some, but they do not like it. They do not want to be. The risk of alcoholism is 21 times greater for the patient with antisocial personality disorders um, than for the general population. Pretty high. The role of a nurse with these patients. Come here, Miss Susan's in here. Say hi to them, Miss Susan.
Hello. I got to keep my social distancing.
Look, she's even got an umbrella. She's like Mary Poppins. Y'all need some humor on these videos.
Practically perfect in every way.
Yeah. So look at her. She's Mary Poppins today.
I know how to delete YouTube videos.
Well, yay. We need to know that.
Yeah. I showed Val.
Good.
She might can teach you.
Okay. You gonna be here a minute?
I can be.
Okay.
Yes.
All right.
So, yeah.
I mean, I'm good, but.
Did Stacey come in here?
Yeah, she did for a minute. All right, y'all. Sorry. You know how we are up here. We all have to talk to each other. Yeah, I know a class that has to talk to each other too. Okay, so let's get back to this, and it won't take us too long to be finished with this. Patients with borderline personality disorder tend to respond best to a predictable, structured environment. So a lot of times, mental health, they will perform better if we keep a structured environment for them. We also need to pay attention to their safety, make sure they are being safe. The nurse can help patients with histrionic personality disorder to focus on themselves for problem solving rather than expecting others to fulfill all their needs. The patient with a narcissistic personality disorder can be helped by developing coping skills that involve independent problem solving without exploitation of others. So narcissistic personalities, y'all probably heard that word. You probably can think of some people that are posting a lot on Facebook about themselves sometimes. Maybe they can be put in that. I'm not saying that, but sometimes you think that. So we have a challenge in working with patients who have dependent personality disorders is to support these patients to make their own decisions without giving advice on how to act. When working with the patients with obsessive compulsive personality disorder, the focus of treatment the patient is affected by the disorder. So let's collect and document. Each personality disorder, when we talked about, was in three clusters. When working with patient cluster A, the odd and eccentric personality disorder, the nurse will collect information about the patient's mental status, anxiety level, and ability to cooperate with others and document this information objectively. The nurse will collect data that indicates the patient's thought process and document. They may be documented objectively. Patient in the bathroom with the door closed yelling, stay away, don't hurt me. When working with patients with cluster B, personality who are often at risk for violence to themselves, that's the borderline personality disorders, uh, are at risk for violence toward others, that's the antisocial personality. The nurse will gather information about behaviors indicating these risks. The nurse working with patients in cluster B personality will collect data that the patient's mental status and behavior document is specifically and objective for them. They might be in the form of the quote, patient states, I can't possibly take this medication unless the chief of surgery brings it to me. What are you going to do with that one? The nurse works with cluster C personality disorders, will collect data about the patient's functional ability, mental status, interpersonal relationships, and document the information objectively. The nurse will describe patients' behavior and statements that reflect mental status or patient's response to intervention, because all that we chart helps the doctors to see really where these patients are. We got to prioritize the importance of the patient's behavior related to our nursing actions. Personality disorders, as I said earlier, are difficult to treat. Often nurses find it frustrating to work with these patients. We've said that again. To work effectively with patients with personality, nurses must understand them first. Them first. Nurses must have insight to know what type of behavior causes their stress. That would be something we need to pass along to our other nurses coming on. If you figured out something that maybe they haven't, to help this patient do better. Priorities of care are to maintain professional boundaries and facility policies and provide reassurance about plan of care. So we need to think about our nursing process. The priorities of care with the patients who have personality disorders in cluster A. Are to maintain professional boundaries and facility policy to provide reassurance about the plan of care. Because remember, they are the odd and eccentric, the paranoid personality disorders, the schizoid personality disorder, and schizotypal personality disorder. Assessment of patients in this disorder, cluster A, includes objective supportive and objective data of the mental status. One nursing diagnosis for a patient with personality disorder in cluster A is disturbed thought processes. They have very strong disturbed thought processes. Um, Nursing interventions for diagnosis of disturbed thought processes, though, include not ignoring the patient's suspicion, but overemphasizing the fear of the patient or overemphasizing the fear of the patient. Approaching patients with a matter of fact, professional attitude, reassuring the patient that they are safe and the staff is making every effort to provide accurate, quality care for them. They need to make sure they adhere to the strict rules. If we used impaired social interactions, another national diagnosis used with cluster A personality disorders. A possible expected outcome from impaired social interaction is that the patient will participate in brief interactions. Um, Evaluation whether the patient is achieving nursing care outcomes involves collecting the following data: how the patient interacts with others, verbal and nonverbal. The priorities of nursing care for patients with cluster B, they're the dramatic, the emotional personality disorder, antisocial personality disorders, borderline personality disorder, uh, histrionic personality disorder, and narcissistics, including encouraging independent problem solving and managing professional boundaries. Um, Cluster B personality disorders are really at a risk for violence toward themselves, and they are usually the borderline personalities, and the violence toward other are the antisocial. There's a high group of these folks that are in prisons. Um, the nurse needs to collect data about the patient's mental status and behavior. Sometimes patients with personality disorder cluster B can disrupt an entire nursing unit if you allow them. To prevent personality disordered patients from attending and use, follow straight and make the rules clear. Stick to the rules consistently. When a patient is causing staff to be upset, have conference, include the patient in problem solving, and remember who the patient and who the professionals are. A nursing diagnosis for a patient with cluster B personality disorder is at risk for self-directed violence. A possible expected outcome is that we don't want him to have any harm. Um, Another nursing diagnosis often used with cluster B is risk from other directed violence. The possible expected outcome, the patient will not harm others and will comply with unit policies. Uh, the focus of care when working with cluster C, we're going to move on to cluster C, is providing safe professional atmosphere in which the patient can express anxieties and identify needs. When assessing the patient with cluster C personnel, the role of the nurse is to help patients deal with the efforts of the disorder. The nurse collects information about the patient's functional ability, mental status, and interpersonal relationships. Family members may be a source of information about the patient's functional ability at home. A nursing diagnosis for cluster C personality is anxiety, always anxiety. With possible expected outcome, we need to discuss the feelings of anxiety and identify the situation. So we've already kind of gone through anxiety. We just need to look at their way they cope. We want them to have no harm or harm to self or others. We want them to have adequate sleep and sleep on a normal schedule. So we need to all be aware of what type of personality they have, what we need to do for that. Always approach them in a professional, calm manner. Just be sure you read over the chapter. We'll be talking more as time goes, and review some more for this personality, the personality disorders. Hope you enjoyed it.